I'm alive and we've done it. I have had the surgery, the double jaw surgery, the MMA surgery, however you describe it. First, I want to apologize. Obviously, I know in my last few videos I said I would be doing weekly updates. I think I realized though, and again, I should have posted something to put this out there. Not much is really changing week by week as you get closer to the surgery. Eventually, the surgeon, gives you the green light. Your orthodontist gives you the green light. They schedule you for the date, and then for me, it was a few months out, so I was just kind of in a holding pattern. But to back to what this video is going to be about. Obviously, it's going to be an update, everything leading up to that point, how the surgery was, where I'm at, and all that fun stuff. As you can hear, uh, talking is a little bit difficult. We are at day 18 post surgery, so about 2.5 weeks out. My mouth was wired shut for about 2 weeks, and then they opened it up, and now I've got some rubber bands on the side of my mouth that I have to wear pretty much 24 hours a day. And as you can hear, sometimes the saliva just kind of pools that I have to just get rid of. But, so, once I got the green light, we were in a holding pattern. Nerve wise, I wasn't too really scared or anxious. I was more like this anticipatory nervousness, just getting ready to get it done. I was mentally preparing myself for it. And then I was literally having, lunch with my dad the day before the surgery because I was going to be staying with him afterwards. So I was passing off, things that I would need, clothes, toiletries, things like that. But there was a small chance that my surgery was going to be rescheduled because of a strike that was happening. But lo and behold, while I was with my dad, I got a call from the hospital saying that my surgery was good to go. I was to show up 5:30 a.m. the next day. Surgery was going to be at like 7:30, and then we just go from there. Once I got that call, the nerves were starting to kick in a little bit more. Again, I was looking forward to it because it would have sucked if they had to reschedule my surgery. Because you're really mentally preparing yourself for it. It would suck to prepare for it all the way up to this point and then to just like be told, hey, you have to wait another few weeks or a month or however long it would be. Plus, getting time off of work, that's really difficult to do too, and trying to reschedule that. But with that said, nerves were with me pretty much the rest of that day. I didn't get too much sleep that night. I slept maybe 2, 3 hours at most. I was up at like 1 a.m. and then I just kind of stayed awake. I got an Uber from about 4:15, took it to the hospital. And the hospital that I got it done at is really interesting. Knock on wood, uh, there's me knocking on wood. I've been a relatively healthy person. I haven't had any major surgery at a hospital. So for me to see this for the first time, it was pretty streamlined. There was a whole area for operations and surgeries. There's a desk that opens up, and then there were a few other people there early in the morning for various surgeries. Once the nurse calls me back, nerves kicking up again. And then there's this whole line of beds where they take your weight, they take your vitals. They say this is going to be, where you lie down, get in this gown. I have to say the day team, the nurses there in the morning were phenomenal. They were steady, they were cool, which was really reassuring because if you've followed my channel, I really like to think about how to apply mental resiliency through this prospect. And it was really giving me a good perspective because to show how much of a system this was very routine. I might have mentioned before, my surgeon, this is all he does. He does 2 of these a week. To see just the procedure of me going in the bed to putting the IV in my arm, which was a nightmare, by the way. They tried to put it in my hand, but because I was so nervous, they couldn't find a vein. They had to pump heat even through the bed. But to know that they had a machine to just pump heat through the bed to warm me up shows that they know what they're doing. And these people that are there, they trained for years to make sure that this thing goes well for you. But my surgeon came in, we talked a bit, and then he basically said, all right, once the time comes, we're going to give you some of the good anesthesia. We're then going to wheel you into the room. We're going to have another chat, and then we're going to, give you the real good stuff that's going to knock you out. So once they were giving me the first round of anesthesia, it was basically the mask, and then they tell me to take some deep breaths. They told me it was just straight oxygen. But I'll tell you, the next thing I knew, I was waking up from the surgery, and it was all done. Again, to show the real reassurance that there's nothing really to be worried about. I was really worrying for absolutely nothing for how routine this was. And when I woke up, it's exactly as other people have said. It's not so much pain you feel, it's just the pressure from the swelling that's going on in your face. And you really don't know what that feels like until you actually feel it. Not to mention the numbness that goes on, because you hardly feel anything in your face, which I'm still experiencing now, and I'll talk about in a minute. Woke up from surgery. I didn't feel too loopy, to be honest. They made sure everything was looking good, and then they wheeled me from whatever recovery area I was in to my own room. And then I just kind of stayed there. I was supposed to be there for the whole night, which I was. And I say that to preface that it was not a good night. The room I was in, for whatever reason, the light was on, and the nurses couldn't even figure out how to turn the light off. It's like I would buzz them to come look at it. They would try it, and then they would just walk out and not let me know like what they were going to do about it. It wasn't until this other nurse, I don't know, clocked in at like 4 a.m. that she was able to come in and see what she could do with the light. But at that point, like, it was already 4 a.m. I had not gotten any sleep at all. It was a rough night. But the some bleeding, obviously. They gave you precautions. They gave you medications. I was able to head home with my dad at about 12:30. And so let's talk about that recovery once they get you out of the hospital. We were driving from Orange County to North County, San Diego, where my dad lived. We were expecting nausea, bleeding, whatever. Luckily, I didn't have any of that. But everyone says the first 4 or 5 days are the worst, and they are not lying. Not only are you trying to manage the random bleeding that happens from time to time, you're also trying to manage this pain. I was getting migraines every day. I had to make sure I was taking the medications every 6 hours or whatever they were doing. And then you have to sleep in an incline. So if you're going through the surgery, I would recommend asking just what kind of incline you're allowed to sleep at, because I was literally sleeping like this, which was not helpful at all. Didn't get any sleep literally the first 4 nights, which was making me really delirious. It was not a fun time, but luckily, by day 5 or 6, I was able to get a few hours. And then by day 5 or 6, too, the migraine stopped. And that was really when things started to get a lot better for me. We did the 1-week post-op appointment. The surgeon said everything was looking good. My mouth was still wired shut, and we were doing the liquid diet that we had to do, which I guess I'll talk about now. Literally, it's liquid. I tried. I'll admit. I hope my surgeon wasn't isn't watching. I tried cheating a little bit with some like soups with like little particles in it. I wouldn't even recommend that because those particles won't be able to get through your teeth into their back. So it'll literally just clog um, the gaps of your teeth and make it really hard to breathe then. So literally, I would strain stuff, and I'll show you what I did. Um, I got a 30 case of Ensure from Costco. That was a lifesaver. You drink two of those a day, and that'll help with a lot of the nutrition. But that said, I was losing a lot of weight. I am down about 13 pounds. Luckily, I've been steady at about 13-pound loss for the past few days. So I'm getting enough calories now, I think, to sustain myself. But yeah, let me show you what I did. First thing is they will give you something like this at the hospital, or at least they gave me this, which is literally just a pipette. You stick it in your mouth and you're able to syringe soups, Ensure, anything like that, which is really helpful, especially the first week or two. You can get a little bit more substance by buying canned soup. And then with the canned soup, if you have the funds, I encourage you to get something like this. This is an immersion blender. It's literally, you could see there's a blade on the end of that. You literally just stick it in a soup or anything, honestly, and it'll just blend it. Once you blend it, then you literally just strain it through something like this, and you strain out all the particle bits. And then what you got, at least in my case, whatever I had was able to be, syringed and pipetted into my mouth. And that was such a relief to get like chicken soup, chicken broth, things like that. Something really savory was really helpful for me. Um, so that was nutrition side of things. Sleep eventually got better once I was able to talk to my surgeon. He was basically able to say, again, talking about my personal case, every surgeon is going to be different, for different cases probably. But he said I could sleep at about 30 degrees, which was a lot more helpful. Um, I was able to get a little bit more sleep then that night. Yeah, the other big thing, so I was staying with my dad for, a good amount of time for about a week. And then at that week mark, I was starting to feel a lot better, a lot more like myself. I decided to just kind of come back to my apartment and, start doing my normal routine again, getting back to feeling a little bit more like myself. Because again, when we talk about resiliency, you're not going to feel like yourself, I think, the first week. You're going to have questions of, is it going to be like this forever? Am I going to get my feeling back? And thankfully, that those thoughts fade as the healing process moves on, as you are able to manage the bleedings and the bleedings stop, and you start ultimately getting the feeling back. I'm able to start to get some sensitivity in my lips. I started feeling some sensitivity in my gums again. The sensitivity is really like right around here where you start to lose it all. But again, at this point, 2 weeks in, it's almost normal. It's just a fact of life for me. And I just have to be a little bit careful as I'm starting to talk. The 2 week mark, my surgeon was able to take off the wires or the elastics. And the first day was a little bit difficult because you're essentially relearning how to talk. Just take it easy. This is the third day without those elastics on. And I'll tell you, talking is much easier than it was that first day. So just take your time. It'll generally come back for you. And yeah, that's it. That's where I'm at. again, I'm alive. Am I glad that I went through the process? At this point, I say I am because I can see my teeth are, I don't know if you can see this, aligned much better. Obviously, they re-stretched everything. They brought forward my upper jaw. Uh, what was it? 7 millimeters. My lower jaw 8 millimeters, and then they did the genoplasty, which is the chin. They brought forward an extra 6 millimeters. So pretty significant, and that's actually where a lot of the numbing comes from, is just the stretching of the nerves. Final say for those of you who are kind of in this process waiting for the surgery, trust your surgical team. This is literally what they do every day. The process is going to happen. Modern medical science is wonderful because you're not really going to feel anything. You're not going to notice anything. And yeah, I wish you all the best of luck. And I will do my best to give a few more updates as I kind of go through this healing process. But that's where I'm at. Take care, and I'll see you next time.